Thank you for all staying around. It's been an absolutely fantastic day. I've met so many fantastic people. Anyway, on with the business. I'm here to tell you about a care and science partnership. And actually, as I've been listening to the conversations today, I kept thinking, oh, great, because I'm going to be talking about that. I'm going to be talking about that. So hopefully this might start to bring together some of the strands of the discussion that we've been having. But NICHE-Leeds, which stands for Nurturing Innovation in Care Home Excellence in Leeds, is really a platform for making sure we connect the right people to be able to address the questions that really matter within care homes. So I'm not going to apologise it's in care homes. I know social care is so much bigger, but I hope as I go through this, you'll see the potential of this sort of model for any aspect of health or social care, actually, but particularly social care. So NICHE, I just want to start off by saying it is a collaborative model. It's all about ways of promoting research that will make a difference, innovation, and importantly, building capacity within the sector. So why do we do this? NICHE-Leeds started about 8 years ago. We're coming up for our 8-year anniversary. And it started because in Leeds, we were looking at the living lab in ageing and long-term care in the south of the Netherlands and realising they were doing something really special to try and find ways to generate research that would make a difference in the everyday. So we hosted an event in Leeds where we brought Jan Hamers, who was leading that collaboration at the time, to just talk about what he was doing. And at the end, I posed the question to a whole load of social care leaders across our city and said, could we do this in Leeds? And a few chief execs of care organisations stood up and said, it's not should we, it's we should be. No, it's not could we, it's we should be, and let's make it happen. And that's how NICHE-Leeds got off the ground. And what connected us was that what we really want to do is raise standards for older people living in care home environments, but also raise the standards of the quality of work for people there as well. Because when we think about enhancing quality, we're thinking of it in that broad sense. It's about improving quality of life, care, and work. And all of this, we've said it throughout today, it takes partnership. You know, research is only going to make a difference if you've got the right people involved, helping to co-produce, and you've got them involved at the right time. So what NICHE-Leeds does, and I will tell you about how it works, but we bring together, you know, the residents, their families, staff, researchers, providers and policymakers all together so that we can address the priorities. We're trying to create evidence that will make a meaningful change. And it's also about equitable access to involvement, engagement, participation. And we approach this saying, everybody has an equal voice in this partnership because we all bring some form of expertise that will make a difference. I just want to pause for a moment and say, I know there are all sorts of absolutely fantastic care and science partnerships that have gone on, some that have had funding that may not have continued, but the spirit and the will is still there. So I'm actually speaking on behalf of all of them as well to say, I really think this is the way forward for our research, whatever we're doing, and you know, really want to try and encourage us to think about how we can create these models. So there should really be hundreds of us on this stage, but I knew we wouldn't fit. So I am here being the voice of NICHE-Leeds, but I've put a few people up on this screen just so that you see there are a whole raft of people involved in this. You'll see Jan and Hilda in the top right, and they're from the University of Maastricht, and we work really closely with them. And it was their model that inspired us, and we took components of their model and have applied it in the city of Leeds. But what you'll also see on here are chief executives, you'll see residents and their families, we've got policy and community partners. And what NICHE-Leeds does is it has to thrive on that multi-sector collaboration. And so that's why I just really wanted to put all of these up. And there are so many more pictures, and this is not even 10% of the people involved. And I also put these pictures up because it's about relationships. And so, our family and friends group, they went to the Yorkshire Sculpture Park, they go to the beach. The beauty of living in the north is you've got all these fantastic opportunities to go places, to build those relationships so that you can have honest conversations about what really matters. And we work really closely with colleagues across Europe who have also got these models. And it was a pleasure of mine to meet. My timer's not working, so somebody might have to, okay. Sorry, I just noticed, and I will get carried away. It was my pleasure to meet a robot in a care home in the Netherlands that I can only say was having an existential crisis, because when I spoke to it, it asked me, why am I here? So you can see, and you'll see in the centre, Jan came and taught some students. So NICHE-Leeds, yes, it's about research, but it's about creating like a learning culture and an environment that we really promote care of older people, that we think creatively about who needs to be involved to address things that matter, and that we prepare the future health and social care professionals for being able to work effectively within the sector. So lots of things going on in this. So our partnership is very much about older people. So we're focusing on those older people living in the homes and the staff that support them. And this really is about genuine interdisciplinary collaboration, and lots of other people I know are doing this. But we address questions together. So we've heard it. Lots of people today have said we have to listen. And that is absolutely the starting point. And then we would say, then we do things together, and then we offer sustainable solutions. So how does that look? Well, we start through relationships, listening. What is it that matters to you? Where could we find research that will help you either in your day-to-day work or make a difference to how your life feels in this care home? So we co-produce those questions together from the very start. And then that relationship continues right through to the outputs and the knowledge mobilisation activities that we engage in. I will talk about the way we've kind of funded this model, but I think what's really important to say is that as we do that, all of those individuals have been part of our teams that have been funded by the NIHR. So whether that's a family member, a care worker, a chief executive, whatever the question is, those people are built into our research grants and really active team collaborators. So we build our teams with the purpose of being able to try and embed what we do in day-to-day practice. And I think that's so important, because if we want to try and create sustainable solutions that are evidence-informed, I honestly believe this is the only way to do it. So you probably want to know a little bit about our structures. And I think this is maybe where our Care and Science partnership is slightly different, but there'll be similarities. And I think we all use different language as well. And language has been picked up a lot today. And I think it's such a crucial part of how do you get a shared language so you can so everybody can go along. I can sit in meetings and think, I have no idea what that chief executive is talking about, but we have to find a way for that shared understanding. But in our sort of model, the ones that are really key are the linking pins. You'll see them here on the right. So the care organisations in our partnership pay for a researcher to be in their care organisation for 1 day a week. I feel incredibly lucky, but those care organisations have said, I really care about the development of staff in my organisation. I'm going to invest in this model. It's really important to us and for the care that we want to deliver. So initially, NICHE-Leeds started on that, if you like, investment, very small investment. And then what we have gone on to do is secure NIHR grants that have then sustained the research. And we've been really successful at that. And I think the reason we've been successful is because the questions really matter, and the right people around the table designing the question, but then suggesting what methods that would be feasible, and then we're generating outputs that they have helped develop and say this will help, colleagues like me in addressing this. So so the linking pins, absolutely key to this model. The next thing I'd say is that Oh, sorry, and I should say, so we have a linking pin we call the science linking pin, who sits in the university, and they are partnered with a practice linking pin. And I think it's that bridge between those two links that makes a difference, because the person in practice can help that science linking pin get to the right people, to have the right conversations, broker those relationships. So that's our kind of key starting point. And as projects start to develop, I always say this, it's like casting a big net where we go, right, who do we need to catch into the net and bring them in because we need you? And I'm going to tell you about one of our projects. And I met Georges, who spoke this morning, because we have had quite a big study going on around mouth care. And so, as an example, having dentists involved in that study, incredibly important. So we cast the net, we bring the right people in, whether that is other researchers, staff in the organisation, or it may be within the local authority, and older people themselves, their family and friends. So that's kind of what it looks like. And there's people ask us difficult questions as well. We started in 2018. We have 3 care organisations who partner with us. People might say, well, that's not very many, Karen. But actually, in the Netherlands, that have been going for 27 years, they have 9. And I think it's not about the number, it's about the quality and what it is you're trying to achieve. And so for us, questions that get raised in these organisations, we sense check it. We work across care homes across the country and actually internationally. And so this is our starting point, but the activity that unfolds is so much bigger. So what we are doing is, in this kind of what looks quite a small partnership, they are really diverse care providers, but we're building that capacity and we're trying to generate questions that will have not only national, but answer questions that are not just national, but internationally important. So in our NICHE-Leeds partnership, I said we're focusing on the priorities for older people. And we've kind of put our work into 4 big themes. So just to give you a little bit of a flavour of what we do, some examples. So we have a lot of work that people either working or living in the sector have said around the workforce. So we've been looking a lot at how you attract, recruit and retain, whether that's generally the care home workforce. We've had projects around recruiting more men into the sector, and we obviously have the Younger Persons Project, which some of our NICHE-Leeds partners were involved in helping shape that as well. Aspects of fundamental care, I'm going to tell you about our mouth care project, but we've also got projects that are around things like how to support someone to safely we shouldn't say wander around the care home. I'm still working out the language, if anyone can help me, but how they explore their environment safely, maybe, and some end-of-life care projects as well. When it comes to enhancing quality, it could be anything around better medicines management. We have a study around tailored music interventions that will be embedded within residents' care plans, how to support someone with distress, falls. And then we have projects around the environment, which someone asked about earlier. And we've just started a big project around people's preferences for technology. What we find is that a lot of tech companies are coming and saying, you really need this bit of equipment. And so on the science side, we always go to the chief execs, but do you really? So let's look at the evidence. Does that really meet what you need? And we're doing a big piece of work that's now funded through the NIHR School for Social Care Research to really understand what are the attributes of technology. So what are the key things that people put in their decisions when they're making choices about technology that will support older people living in care homes. I love this picture. There's a view from the Yorkshire Sculpture Park. But what I really want to say to you is, in these partnerships, it's about the active involvement of people with that lived experience, whoever they are, right people in the team at the right time. And it's that whole system approach and that engagement that is what underpins all that we do. I really want to give you an example so that you go away kind of really understanding how we try to operate as a research collaborative. So this is Dawn. Dawn is a care worker in one of the homes, And when we were starting out very early in NICHE-Leeds, we were having a conversation about how difficult it can be to support somebody with their mouth care, particularly if they are resisting that care. Now, Dawn didn't ask the question like that, but that's the beauty of having people together, because Dawn could tell us what was bothering her. And then on the research side, we went away and we said, we can turn that into a question that we can see what evidence is already out there. So a whole series of things happened. And I think what's quite incredible is when we see Dawn now, she's like, I never realised that day I was asking something that internationally people are really struggling with. It's just not me living in Beeston in West Leeds. And I think that's a really important kind of aspect of what we do, that sometimes there's nowhere for care staff to take these questions. And so what this relationship allows is for that discussion to happen and for people to realise this is a really important question. Let's see if we can help you. In summary, Dawn asked the question, we went away, there was a systematic review. Somebody said, how do we get the language right? Language and systematic reviews, impenetrable if you're Dawn working in a care home in Beeston. So we took that, we translated it, and when we took it back together as a group, we created what we called the niche know-how. Dawn and our colleagues said, we just want to know how to do something. I mean, it's just lovely. Behind that know-how, there's a whole load of information about strategies. So whatever the resistive behaviour might be, here are things you can try. It really helped build confidence amongst the staff. And what was interesting, they said, is it just me that feels like this, or do other people? So we then surveyed, we realised there were deficits, if you like, in knowledge, skills, attitudes, but we didn't present it as deficits or lack of knowledge. What we did was we created posters that were positively framed to say, did you know, this is what you could try? And obviously, it's all the things we knew they didn't know, and that might actually help. And so there's ways of working to really try and get these messages out. And what's lovely is these posters were launched in our homes, but actually I go homes across England and I see them up in homes and think, this is great, the word's getting out. So we then went on to do a study where we looked at how we could support staff behaviours to spend time on mouth minutes. And so I think I'm going to go for it. I've got 3 minutes, but I can wrap up in one. So could I put a video on? Because I think what's really important, we've talked about translation. And so together, I think something quite special has happened. And it's taken us 7 years to get here, but we've created what we've called a virtual care home. It's the first stage where we've put information about the mouth care study. It's a bit of an introduction to niche, a bit of mouth care, and then about how you get involved. But the idea is this will be, we've developed it together. We want people to get to know the characters. So there's a manager, there's care staff, there's residents, and we'll build the characters over time and all the resources will appear. But you can go on, it's freely available, even though we've developed it together. We'd love to know what you think. You can meet our characters, and all the resources that we've developed together or you can access through there. So if you'll indulge me, I'll show you it's less than 3 minutes, and I've only got 2 minutes 19. Nuno, forgive me. Sorry.
Welcome to NICHE-Leeds, where researchers work side by side with care homes to improve lives, care and work. Research helps us test new ideas, understand what works and share those solutions. Our researcher, Farah, is showing Malcolm the importance of mouth care by following our guiding principles so he can support residents who have dementia with their mouth care, like Davika. Research provides Malcolm with tested techniques. With the know-how from NICHE-Leeds, Malcolm's ready to support Davika's mouth care. When Davika is reluctant to open her mouth, Malcolm knows he can use distraction and mirroring to make brushing teeth stress-free for both. By joining the NICHE-Leeds Virtual Care Home, you can learn too. Join us and feel confident by knowing the care you deliver is backed by world-leading research. Research made together. NICHE-Leeds, where practice and research changes lives, care and work. Our care home family is growing and you can be a part of it. Join our virtual care home today.
So you can join our virtual care home family too, if you like. So I hope you get a sense that really what we're trying to do is, through our research, like improve everyday practice. We're trying to create stronger organisational cultures for learning and improvement, and importantly, enhance staff capability, their confidence and their curiosity. And I think curiosity is the thing that I feel we've really started to achieve within the NICHE-Leeds partnership, and that is so key. People knowing there's no such thing as a daft question, that actually if you can't understand the evidence, that's our fault, not yours. Let me help you to get the answer you need. So that curiosity key. And through sort of this way of working, we're really starting to increase the uptake of innovations. And I think importantly, really promote care homes and the people living in there and the complexity of what's going on and the fact that research-informed care really could make a difference. So for me, this is recorded, isn't it? Yes, so academic outputs are really, really important. But they're not the only thing. And so, for me, I want to acknowledge Terry Hall, our Impact and Engagement Fellow, who created the NICHE-Leeds Home, and he's got such ambition and plans for this, working with our care home partners. And I think it's going to be really exciting to see where it goes and develops. And we wonder, could it be somewhere where other researchers want to host their findings? So I'll kind of end here. You'll be relieved to know, Nuno, and just kind of finish by saying, I think through this way of working, this care and science partnership, what we're really trying to do is build that, I guess, a global learning community around care home improvement. We're trying to really demonstrate how change can be achieved through these collaborative research endeavours. Our networks are expanding all the time, and I have met some great people today. They're going to regret having met me. I will be in touch because, this is what makes research live and will make a difference. And, we've been really growing capacity amongst people working in the homes. Our family and friends panel are so engaged in our work, but also some staff have gone on to do master's degrees, some are thinking of PhDs, but actually a lot of them are saying, I'm not scared of research anymore, and for me that's the most important thing. So I think NICHE really kind of captures what today is about and the themes of today, about collaboration, about how you turn priorities into research-informed change, and that you can grow a workforce across settings to really amplify social care voices and particularly those underrepresented in research. So that's me. Thank you.
For questions? Karen, I'll start with questions. So I think one of the things that I really took from your work is the impact and the kind of roller coaster of impact that is kind of being kind of perpetuated. So it's not just for the care homes that you're working with. We can all learn from all this. It'll be national, it'll be international. If you were starting off again, did you expect your work to have this much impact, or is this something that kind of grew naturally?
So I think because we were looking at the model in the Netherlands and we'd seen how their work had really taken off, the ambition was to do the same. So there's been a plan in our head all along of if we can get care organisations to initially invest, we'll apply for the research funding after. Now that it's a bit of a gamble, but that's the model we've gone with. And I hate saying amounts of money, but the NIHR have really supported a lot of our research. And, you know, if I said to you over the 7 years, we've had less than £300,000 from care organisations, at the last count, we're over £20 million in research income that's addressing questions that people have told us matters. So, and I know that bubble's going to burst, by the way, but, you know, you sort of, for me, I think that speaks volumes, and it's not about the amount of money, it's the fact that that money is really supporting research with and for the sector. And I just feel it's our responsibility on the research side to make sure we do as much as we can, you know, so that the NIHR gets that return on investment as well, to share all of this work. So I think, you know, we're trying different things. I feel because a lot of it's informed by what people in the care homes are telling us. You know, it's little things. Listen to Georges this morning. You know, that relationship between your mouth health and your physical health, or your social and your quality of life, so important. Lots of staff in the care homes told us they didn't even know that. So together we're actually creating a poster, and it's called Putting the Mouth Back in the Body, because actually to understand why this is so important for everything else, they were like, I didn't really know that. And, you know, as a nurse, I'm like, I just didn't know that you didn't know that. So now we do something about it. So sorry, I'm waffling, but I think I wanted it to be the ambition, and it's just fantastic that together we're making that happen. There's so many people involved in it.
Huge congratulations.
Thank you.
I've got a question myself. It's Nuno here. How replicable is this model in other areas of the country?
Care homes specifically, or elsewhere?
Yes.
Yeah, we'll start with care homes. So I think you just need to find the right person, and I know that can be really, really difficult. And I think every area, you have to adapt it to your local context. So, you know, we have been able to secure some funding, but I know in other areas, trying to set up, if we call it a living lab, because that's what they call it in Maastricht, is the ambition. And I think if you can get a willing partner, it's a good start. It's a good starting point. So I think, you know, if you have someone on the research side who's got that research vision, and you've got someone on the care side with the vision of what it means for care, there's absolutely no reason why other people can't do this. I mean, I do think there are partnerships going on, and I don't know if we all know about each other. And so, you know, if anyone sat there going, actually, we're doing something quite similar, Karen, I think we should all join up, because I think that's what we've managed to do with Maastricht and some of the other European countries doing this, but maybe not done it so successfully here. So a bit of an offer that I'd absolutely love to work with other people. You know, and if you have priorities, you know, sometimes I think the same questions come up time and time again in different homes. And so if we're going for research grants, actually there's no reason why we can't bring in a broader group of people, and we've done that a lot as well. So so I think it is, with the right people driving it. Yeah. And I think it could work in home care. Somebody said to me the other day that video actually, and all the resources we've developed around the mouth care topic, actually applies for looking after someone at home as well. So I think you know, it isn't really just care homes what we're doing, and we have got a portfolio of work with home care as well. So yeah.
Hi, the talk definitely did not disappoint, and I loved the video, it was amazing. I have a question about how you engaged with the care workers to get them to share their ideas about what research needs to be done, because I've found that when I've had shorter care home visits, I've actually had to spend a lot of time actually almost giving permission to them to because I feel like sometimes people don't want to sound like they're complaining, but I'm actually looking for a problem so I can help find a solution. So how did you sort of give them, and you're a stranger sometimes in this care home, so people might feel a bit guarded about saying things that might not be quite right. So how did you go about helping them to open up and share their thoughts?
Yeah. I mean, it's a great question, and there's no one answer. I mean, it's all about relationships, isn't it? And so so that's where the linking pins, I think, are really key. So I think if you don't have that model, but you are the researcher going in, it's how do you spend enough time in that environment for you to look a little bit more familiar? Otherwise, I mean, let's face it, there are so many people coming in to criticize the environment and assess the environment, that you have to stand out as something different, with a curiosity, with an interest. So we've spent lots of time, and I can remember some of the first meetings. Sorry, I'm starting to laugh because somebody had said, we'll meet in the cafe, we'll get everyone in and you tell them what you're doing. And I look back and cringe because I think my language was terrible. I was talking in, a language that certainly Dawn didn't understand. But what was lovely over time was she didn't shy away from telling me when she just didn't understand what I was talking about. But that takes time. But I can remember people sat arms folded. This has got nothing to do with me. I don't understand why you're asking us what matters to me. Because actually asking that question, for some people, nobody ever asks me what matters to me. So I think you just have to feel your way through that environment, work with trusted partners who can help broker that, and try different things. But we have someone in our team who I remember was like that, didn't really get what this research was about. They've now come to be a trainee in our team through the NIHR School for Social Care Research. They've done their masters and they do have ambition. They've really got the research bug. Not everybody is going to do that. But I think just realizing that there might be an answer also, if you can translate that into a language for people, will help. But it is relationships and it is really hard. And one of the things I found really helpful was to say, when I would listen to people, I'd say, so when you did that, how did you know you were doing the right thing? I might not have said it as direct as that, but that was the undercurrent of the question. Or, when you did that, could you have done this? Just to try and judge. And you'd start to have discussions. And that might lead to some of the opening up of kind of questions or things that matter to that member of staff. So but it takes time, and it should really, yeah.
Thank you. Thanks for that. I'm really impressed with the living lab approach and how deeply relational it seems, and struck by your focus on 3 particular care facilities, care homes. And I'm curious about what are the types of things that you're hearing from people like Dawn in these spaces over time? Has that changed over time, particularly with respect to the areas of enhancing quality and enabling technologies?
Yeah. How long have you got? So I think what I'd do is direct you to a paper that my colleague Dr. Reena Devi led. So we spent a lot of time priority setting, so talking with, yes, staff, but also residents and family members. And so she's written a lovely paper that will give you all of that. So rather than me try to remember them all, but I think things do change over time. And the thing is, sometimes the conversations are not really research. And that's really important as well, that sometimes people will say things to us and we'll go, well, just do it. I don't think you need a research project to tell you whether you should do that. So some of the communication is about distilling what is a question, what isn't. If it's a question, is it a question where evidence already exists? Can we give that back to you? Or is this a project we really want to develop together? So the mouth care example, I think, is a lovely example of that, because there is information out there, but actually what we've learned over time is there's something about trying to understand how to influence the staff themselves. And so we used COM-B, a behaviour change theory. And when you look at our resources, if you go on to look, you'll recognise it, because COM-B is all about your capability, the opportunities, the motivation that you have to perform a behaviour, mouth care. But we've written it as, I know how to do it, I want to do it, and I have what I need to do it, because that's the language we need to translate. And all of our research is boiled down under those headings. And everything's directed at really trying to nudge things in that direction. So, sorry, I waffled, but there is a whole list of questions that you could come to and see. And other priority setting exercises have happened, and there's a lot of overlap. So I think there's a really clear agenda if you're interested in care home research now. Mm-hmm.
So we have a question from Nazia online, who's asking about the niche model. Does it focus on service users in care homes or on the service providers as well?
It's all of those people. So the people living in the home, working in the home, and we also work with commissioners as well. So the partnership, it straddles all things care homes.
Thank you.
Professor Karen, thank you so much.
Yeah, thank you.